I'm Angela Collins, a pediatric physician. I am from Houston. I went to Raymondville Elementary and then to Houston High School and graduated there in 1995. I went to the University of Missouri in Columbia for my medical training. I did residency in Columbia and then I came back to Mountain Grove for about 7 years and worked there. And then I've been in Bolivar, Missouri at Citizens Memorial Hospital for the last 12, doing clinic and hospital. I'm a small town girl and like small towns, so I wanted to come back to, provide pediatrics in a small town. And so that's how I ended up coming back. I love science and learning, and in school, that's really, what I really love to learn about. So when I was a junior in high school, I took the military ASVAB test, and one of the things on there was a physician, and I thought, oh, that does sound kind of fun. And at the time, there was a television show called Empty Nest that was about an old pediatrician, and it showed, interactions in the pediatric office, and I thought, that sounds fun. So that's how I picked pediatrics over family practice. Pediatrics is just, I feel like I'm an expert in that age. Family practice was a lot to take in. So anyway, I like seeing kids and taking care of kids and families. If there are kids with special health needs that have, lots of specialists, or maybe, babies that have come out of the neonatal intensive care unit, or, especially kids with, cerebral palsy or autism, or, those special healthcare needs that sometimes need a little extra expertise. I can be that person. And also just for, child care, seeing babies from, birth to 18 and walking through that with patients and families is really rewarding. And teaching parents, ways to be healthier and, taking care of their kids and providing that preventive care, immunizations, and just helping with different developmental transitions and preparing parents for that and helping them with those kinds of things is what I like to do. I'm patient-centered. I talk to parents, but, the patient is my number one. And so I, establish rapport with the patient. I 90% of the time can get through an exam without crying, the patient crying, not me crying. So, that's a win. It's kind of a challenge to, okay, this one's going to be a little tricky, but, you have your tricks and things to, get kids to cooperate. I am really easygoing, I like to, listen to families and kind of get an idea of, things that they're thinking. And so that's kind of my style. I love to travel. I like to take cruises. I like to read books for fun now. I like to do some art stuff. I like to paint and spend time with my family. I have 2 adult daughters and a teenage son, and my husband, we've been married almost 29 years. And so I like hanging out with them.